Former Vice President of the Republic of Gambia. Thanks so much for joining us today in your capacity as interim head of neglect tropical diseases. We're happy to have people with such experience in our health sector on the continent. Thanks so much for joining us. Honorable ministers, thank you. I know you have a lot of things to do in your home countries and also in other invitations that are coming to your desk, but you decided to come here because it's important to join this Africa Health Agenda International Conference, AHAIC. We're very happy as a country to host this important conference for the third time, and we look forward to continue making this the home of AHAIC, the home of health financing. Like His Excellency the President Paul Kagame has been a champion of health financing. We just came back from Addis Ababa for the same topic, stressing the importance of domestic financing, how we make sure we finance our health, our systems, rather than just waiting for someone else to take care of our health. And that is the topic we started yesterday. I have the press briefing with the walk, with the run, and we're continuing this week. We still have 4 days to discuss all these topics. Very happy to see big number of people who made it from more than 50 countries, I heard, and it's actually much bigger than last time. So interesting how AHAIC is becoming an important gathering for us, not only to talk and discuss, but also take actions. And actions start with ourselves, with our health. Last night, there was a demonstration on how we take care of our lives, and the message that we demonstrated by us walking 10,000 steps or more. Some of us take fewer. Next time, you do more than that. But it's fine. We always start with small steps, and we encourage others that prevention of diseases is important than the time you go to the garage, as Dr. Gitinji was explaining. So I'm very happy to speak on the first day of the opening of this conference, because the experts, the different sessions are going to address specific issues, but I want to talk about maybe 3 important ones. Number 1 is health financing. We are in a critical phase period where financing for global health in general is being affected, sometimes abruptly. We're seeing programs for maternal child health, malaria, disease prevention and control, very critical programs being stopped overnight by traditional supporters and funders. And this looks like it's going to continue. And we must be ready, as of yesterday, that if this happens, what are the options we have? Yesterday we asked by the media, what are you going to do as ministers of health? If the funding to your programs are stopping, what are the scenarios and the options you have on the table? The reality is that this is abrupt decisions, is surprising, and is going to have an effect, definitely. There will be effects, mainly to the poor communities across, but we also have the means, and we have the courage and the commitment to prevent these damages and impact to happen to our communities and our programs. It's actually another booster, it's another energy for us to go back and see what can do even better and faster without relying on resources that are not sure if tonight will still be available. How do we build health systems that are grounded into the community, strengthening our primary health care, spending $1 to achieve $1,000 value impact, rather than waiting until you need those PET scan, MRIs, and probably operations that are too expensive to our systems. Redesigning our programs is going to be the driving agenda for all of us, and even do things differently. We saw many examples yesterday. What do we need to do now in these situations? Do we need to run 5 days trainings for 5 billion versus ensuring that our supply chain of medicine is maintained and ensuring that we can train within our hospitals, in our villages, we can use these gatherings in our communities to pass the same message without bringing people into expensive context? How do we make sure vaccines that are so important to protect our children and our communities are not interrupted and not stopped? How do we make sure these antiretrovirals, these malaria drugs that are so important, critical, are accessed to the affordable price and actually produced locally? These are the questions we are going to be discussing this week. Not just discussion, but take concrete actions. What are the alternative options we have? If we have top 10 priorities, how do we make sure the next list of priorities are done differently so we keep and fund most critical areas of programs? These are the most important questions for us this week. Everyone is trying to put an answer. But I think coming together, all of us, we're going to make it happen. We are going to mitigate these anticipated risks and pressure to our systems, even if the decision came overnight and we're not prepared, but we knew that this is not going to be how it was. So that's the first one. The second one is now about the disease we are dealing with. We're transitioning from non-communicable, infectious diseases to non-communicable diseases. In all countries, actually, in Africa, more people are dying currently from cardiovascular diseases, cancer, and diabetic metabolic diseases. These are the top 3 killers of our communities today. It wasn't the same case 15 years ago. 10 years ago, it was totally different. It was TB, malaria, diarrhea, and other infectious causes. But these infectious diseases are still there. So we have both now. It's a double burden. Dealing with both is going to require adapting our systems to deal with both the infectious diseases and non-communicable diseases. And the best way to deal with non-communicable diseases is what we did last night. It's changing our lifestyle, educating our communities that we've been telling them, clean your grounds, mosquitoes are going to grow, don't let water stagnating next to your house because mosquitoes are going to affect you. We are going to change also to tell them, look, don't drink too much alcohol. Salt is not the friend of your heart. Sugar is not the friend of your pancreas. You need to walk 10,000 steps a day. You need to take care of your health. You need to do checkups every day. These are the things we never told our communities enough. But we have to. And you have to do both as we tell them. Malaria is there, HIV is there, TB is still there. But heart diseases start progressively until we get in a situation where they don't even know. And they think it's something someone has brought to the community. This is how we've seen diseases that were never been told to our communities, like cancer, cardiovascular diseases, stroke, heart attacks. These are happening now because we're seeing people living longer, but also lifestyle has changed. The type of food people are eating have changed. So these are the second point I want to stress that we also think about this week as we redesign the health agenda for Africa moving forward. The last one, quite important probably, is going to help us draw a solution to these problems. It is how, as a continent, as Africa, we design technologies in a proper way that they help us answer these questions, sometimes bridging the gaps, sometimes equalizing and help us to catch up the legacy of delays in the workforce training in dealing with these diseases. So we're seeing technology being said, this is a tool, it's important, it's good, but we should be the first one to stress and even obsess the use of technology where possible, to come up with a catch-up plan to help our societies, our systems, to deal with this pressure, with these diseases. More disease burden, less financing, how do we deal with it? Looks like an impossible mission. In mathematics, we used to have these kind of formulas where you're given a question, find X, find Y, find Z. This looks like you say, no, it's impossible. It has to be possible. The center must hold. The center of our health systems must hold. I got it yesterday, was the slogan of our discussion. The center of our health systems on the continent must hold. It means we must take bold decisions, even if financing is declining. We must increase it. Even if disease burden is increasing, we must deal with it from the base. And even if we think that our traditional sources of financing are getting away, we can raise new financing mechanisms, starting from within and also from other partners who are willing and seeing this as an important investment for humanity. Our center must hold. So let's look at how technology can help us even to strengthen the center of our health systems, like artificial intelligence. How can it help us to catch up with trainings of our healthcare workers? The example of radiologists, it's the easiest I use all the time. Rwanda has 15 radiologists. We need at least 200 to be able to provide the imaging and radiology solutions. But if we have to train more as fast as possible, all that means we're not going to have 200 tomorrow. But if we equip the 15 radiologists with proper technology, with artificial intelligence, making sure they can actually serve with this virtual system, virtual hospitals, diagnostics and treatment, these 15 can manage 14 million people we have in this country. Imagine what we can do for the continent. I believe it's possible, and there's no other option. There's only one way, only one option. The center must hold. So ladies and gentlemen, thank you so much for coming, joining this conference. We look forward to discuss more beyond these three questions. And I believe that at the end of this conference, we must confirm that the center must hold. We have no other option because we don't want to delegate to the next generation these problems. They must deal with other health issues, but not these ones. Thank you so much. Once again, welcome to Kigali.
Thank you. The center must hold, and an example of that is that Rwanda has one of the highest HPV vaccination rates in the world. 90% of girls are vaccinated against HPV. If every country could do that, we would eliminate cervical cancer and would avoid the cost of taking care of cervical cancer, which is more than $10,000 per patient. We can prevent disease, and we can actually reduce our medical care expenditure. Thank you very much, Honorable Minister. I would now like to ask for the video by Tedros. Tedros is invited. He gave his apologies and is addressing us by video. Over to you. Please give us Tedros' video. Director General.
Honorable
WHO.
Minister Sabin Sanzimana, Director General Dr. Jean Kaseya, Amref Chief Executive Officer Dr. Gitinji Gitahi, Acting Regional Director Chikwe Ikwewazu, esteemed guests, dear colleagues and friends. I thank the Rwandan Ministry of Health, the African Union, and the African Centers for Disease Control for joining WHO in convening this important conference. African leadership is strong across many facets of global health, from the scientific advances made during the COVID-19 pandemic and the struggle with HIV/AIDS to the current negotiations around reforming the global health architecture. In this spirit, WHO is committed to fostering the next generation of African global health leaders and to supporting the continent's science ecosystem. All of us must work together to increase international and domestic investment in scientific institutions, to encourage regional collaborations, and to translate research findings into impactful policies and practice. WHO is proud to partner with African institutions to advance these objectives, such as the African Medicines Agency and the mRNA Technology Transfer Platform for Research and Development, and the African Centers for Disease Control. Together, we can harness the power of science, leadership, and cooperation for a healthier, safer, and more peaceful Africa, and a healthier, safer, and more peaceful world. I thank you.
Thank you very much, Dr. Tedros. Leadership, Science, and Cooperation. I'll now move on to one of our other co-hosts. This is Africa Centers for Disease Control and Prevention. We have the apologies from the Director General, Jean Kaseya, and represented here by none other than Dr. Raj Tajuddin. Needs no introduction. He's the Acting Deputy Director General, Africa CDC. Dr. Raj, welcome.
Your Excellency, Madam Aisha Toure, former Vice President, Gambia. Your Excellency, Dr. Sabin, Minister of Health, Rwanda. Excellencies, Ministers of Health from African Union member states. Your Excellency, Dr. Chikwe Ekazu, the Acting RD, WHO Afro. Senior government officials in the room. Distinguished colleagues, ladies and gentlemen, I bring you greetings from the DG of Africa CDC, His Excellency Dr. Jean Kaseya, who couldn't be here with us this morning. Colleagues, ladies and gentlemen, Africa CDC is proud to be a co-convener of this very important conference, alongside Amref, the government of Rwanda, WHO, and other partners who have provided various forms of support. The theme of this year's conference, talking of connected for change, addressing socio-economic dynamics of health, resonates with Africa CDC's strategic priorities. It reminds us of the intricate connection between health and socio-ecological factors. The theme is also a wake-up call for us that indeed the global health space is evolving and it will continue to evolve. Therefore, the path to any successful evolution, the path to any successful change will start with meaningful connection between our systems, talking of sharing information, sharing data. It also starts with meaningful connection between people, between our leaders, as demonstrated in the way we could convene the Africa Health Agenda International Conference 2025. But much more importantly, meaningful connection between different institutions, as articulated in the Pillar 5 of the African Union, Africa CDC New Public Health Order, talking of respected, trusted, action-oriented partnership. There's no single institution that can do this alone. The COVID-19 pandemic, Your Excellencies, did remind us the devastating impact of any emerging pathogen of animal origin on humans, on our society, on our economy. And it also reminded us that it's time to operationalize One Health integrated approach. There has been so much discussion, so much workshops, so much talk around One Health. But the COVID-19 pandemic and the other repeated recurrent outbreak of emerging and re-emerging pathogens on the continent of Africa has reminded us that it's time to operationalize One Health. Your Excellencies, social determinants of health is a necessary prerequisite for us to improve individual and population health, and to ensure that health equity is attainable. Come year 2030, talking of universal health coverage, we need to pay attention to economic stability at the individual level and at the community level. We need to pay attention to learning opportunity, and much more importantly, we need to pay attention to affordable and equitable access to health care. And how do we ensure this? How do we ensure equitable, affordable access to health care? There's no other way other than through a very strong, resilient primary health care delivery system. A PHC that focuses on people's needs, primary health care that empower the community to take ownership of their health, a PHC that guarantees our health security, talking of epidemic and pandemic-ready primary health care. Because as we are all aware, every disease outbreak begins and ends in the community, hence the need for a resilient primary health care. We are also talking of a PHC that is able to leverage digital health, PHC that is able to leverage the 40% internet connectivity on our continent, and is able to leverage the 80% mobile technology penetration on the continent of Africa, and a primary health care that is adequately and appropriately financed. A good example is Rwanda. They've made significant progress as far as the PHC agenda is concerned. So as we all gather here for the next couple of days, let's take the opportunity to understand how Rwanda is able to get it right as far as the PHC agenda is concerned. People have talked about, or the previous speakers have talked about, how Rwanda was able to achieve the lowest mortality rate for Marburg viral disease ever. Again, you cannot separate that success from a very strong, resilient primary health care in Rwanda. Your Excellencies, colleagues, ladies and gentlemen, official development assistance is a key source of health financing as far as our 55 member states, 1.5 billion people are concerned. Today, we have seen rapidly decreasing official development assistance without warning. But we cannot fold our hand. As ministers have been rightly mentioned, our head of states are doing everything possible to make sure that we address this gap. Thanks to no other person than His Excellency President Paul Kagame, the champion for domestic health financing on the continent. It's also a wake-up call for us to begin to look at other innovative ways of financing our health. How do we leverage the private sector on the continent of Africa? How do we make our taxation more efficient? How do we also make sure that other sources of funding on the continent of Africa, the extractive industry, we're able to appropriately leverage them to support, the financing of health on the continent of Africa. Your Excellencies, allow me to shift there and talk about what the DG, Dr. Jean Kaseya, described as the second independence of Africa, talking of local manufacturing capacity for air security commodities, vaccines, diagnostics, therapeutics, other life-saving interventions. President Paul Kagame mentioned that you cannot guarantee your air security through goodwill alone. President Julius Bao of Sierra Leone mentioned that you cannot finance your primary health care through external support alone. So we need to look inward, and we need to begin to manufacture our health products on the continent of Africa. And our head of state and government have provided that political platform. February 2024, they did launch what we call the Platform for Harmonized Africa Health Product Manufacturing. They did launch African Pool Procurement Mechanism, and much more importantly, they have also operationalized the African Medicine Agency, whereby instead of going to seek regulatory approval 55 times, you only need to do it once. And Africa CDC will continue to work with member states and other institutions within the African Union family to make sure that the agenda of local manufacturing that seeks to move or shift the needle of 1% production of our vaccine needs, 1% for 1.5 billion population, will move it to 60% come year 2040. Excellencies, colleagues, ladies and gentlemen, the Africa Health Agenda International Conference 2025 presents opportunity for interdisciplinary, multi-sectoral, and multi-partnership collaboration and coordination to guarantee the air security sovereignty of 55 member states and also guarantee universal health coverage for the continent of Africa. I thank you.
Thank you very much, Dr. Taj, reminding us it's time for One Health. One Health. Thank you very, very much for those remarks. Allow me now to move to the next speaker. Everyone has a boss, and I have my boss here with me. I have the board chair of the International Organization of Amref Health Africa, Dr. Professor Charles Okeahalam, and I would like to invite him to also welcome you here. And we have international board members of Amref, just wave from wherever you are. International board members accompanying the chair. Welcome, Chair. Thank you very much. I hope in his address he'll review my appraisal for this year.
Good morning, everybody. I'm not sure I can follow the act of Gitinji, who places the bar very, very high. But let me try. Excellencies and ministers here present, members of the Board of Directors of the International Board of Amref, Amref Country Board chairpersons and directors and leadership teams of Amref and other organizations, conference sponsors, funders, partners, stakeholders, distinguished guests, ladies and gentlemen. So as chairman of the Amref Health Africa Group, I wish to welcome you all to this Africa Health Agenda International Conference. First of all, I wish to thank the government of Rwanda for once again and for the third time hosting this conference. Thank you very much. Ladies and gentlemen, I am very impressed. I looked at the program for the next few days, and indeed I am very impressed by the high quality, the high technical quality, the high intellectual quality, the capacity of the delegates that have come here, who are made to understand 1,400 experts, specialists who are here. And this is very, very impressive indeed. Ladies and gentlemen, the arrival of the new US administration presents an obvious challenge, but also presents an opportunity. As Minister Sabin has rightly pointed out, there is a big challenge for us with regards to financing. Clearly, the reduction in the amount of funds disposed and made available for aid and development support will place many of our programs in some jeopardy. This has also had spillovers as aid budgets are being trimmed. For example, note the recent announcement of proposed cuts in the UK aid budget from 0.5 to 0.3% of gross national income for 2027, which has been substituted for an increase in defense allocation from 2.3% to 2.5%. Now, I suspect that other nations may follow. This should be a wake-up call for Africa. However, this challenge also presents opportunities for many organizations involved in the very worthy work of healthcare, financing, economic development, and aid support. It also provides an opportunity for host and recipient governments to consider how they work with charitable and non-governmental organizations, and also how to more optimally or efficiently allocate fiscal proceeds. I think it was the Minister Sabin who talked about balancing a system and the mathematics of trying to get an equilibrium. And I was thinking that all we need to do is do an 80-20 Pareto sort of rule. If we can get that, if we improve ourselves by 20%, we might get an 80% improvement. The challenge is real, but not as difficult as it might appear. The theme of this year's conference, Connected for Change, once again reinforces how linked we are, how interdependent we are, and how we need to work together. We need to collaborate more. We need to think together. We need to share more. Artificial intelligence is likely to make lots of things we do somewhat basic, and some of our thoughts might become somewhat mute. But I'm not sure it will be able to immediately overcome some of the nuances embedded in human intuition and response to stimuli. And to be sure, the recent developments in stimuli is significant. Those changes that we're seeing globally are in fact significant, and we need to respond adequately. The key thing that we need to do is we need to rethink what we do. We need to think of new ways of doing things. Ladies and gentlemen, health programs, which the Amref Group and its partners and many stakeholders are involved in, are essential to economic development in Africa. And we do this not by ourselves, but with our partners, our many funders, our many collaborators. And this is essential to economic development in Africa. And indeed, as COVID so vividly illustrated, we are truly globally connected and interdependent. As we all know, health forms the base of the hierarchy of our needs. Accordingly, it is not an overstatement to say that the reduction in allocation of funds will alter the development path for a number of African countries, and this is truly unfortunate. It is my view, therefore, that both the donor countries, classically called donor countries, and recipient countries need to reflect on how they can adjust their programs to meet the constant level of demand. The demand for health services is likely to increase. Once again, I find myself somewhat referring to Minister Sabin's point, but there are ways in which we can change the slope of the demand for health services, that are expensive interventions that cost a lot of money that we don't have. If we go to try to prevent, or as Gitinji rightly said, if we stop the cars from going to the garages, if we are able to prevent rather than try to cure. The fact is that budget allocations are going to be tightened. And therefore, the fact is that, as I've stated, given that health is the primary need, we need to do much now to see how we can adjust given the pressures that are placed upon us to make that adjustment. So let's be somewhat proactive in responding to this rather than waiting for it to arrive at our doorstep. This is not a short-term agenda, to be sure, and it's not an easy agenda. It will mean that we have to make some choices, and we will need to be dexterous, and we will need to be adaptable, and there will be some pain. But in all of that, there will also be opportunity. Ladies and gentlemen, given the policies of the new U.S. administration, the typical multilateral partners are likely to become stretched, and this is augmented by the fact that there are a number of festering geopolitical situations, the war in Ukraine, the Middle East, the conflicts in Burma, the unfortunate wars that still take place on the African continent. These challenges mean that attention and funds that might otherwise be given to health programs on the continent have to scale bigger hurdles. So what should we do? First, in line with this year's conference theme, we need to think a bit more about what and how we do what we do. Apart from the obvious short-term resource mobilization solutions, such as a greater pivot to the private sector and individual giving, we need to take a more strategic look at what we are doing in the overall health funding, health financing, health deployment, health fund deployment agenda, and what we do in the field. As I mentioned earlier, we as Africans need to ask ourselves what kind of future we want. And what kind of future we want will be partially dependent on what we do now and what we wish to leave for our children and grandchildren. In answering that broad question, we need to be clear that we have to act in our own best interest. This means, to my mind, that we start with, we need to think out of the box, as I've said, and we need to put aside some of the conventional ways we have hitherto done things. Secondly, we need to communicate effectively with our partners our desire to increase our self-sufficiency, to agitate for that self-sufficiency, and reduce our dependency. And this is not a popular thing to say. This is not that one is trying to paint Africa as a continent of dependency. No, but it is a reality that we face challenges linked to our inability to find ways to meet the needs that we have. And we need to do our best to stop the temptation of chasing that perennial golden goose. The golden goose doesn't exist. And so chasing it is somewhat an effort. That golden goose, if it does exist, exists in our own continent. We can find the golden goose and the geese right here. There's not just one golden goose, there are golden geese, and they are right here in our continent. So this implies that despite the large range of demands, we may need to adjust our program ranges and more tightly set priorities and focus. This implies a number of broad questions which we need to constantly ask. What specific types of problems are we trying to solve? Maternal health, chronic illness, malaria, zoonosis, pandemics, infectious diseases, healthcare generally. Are we able to prioritize them, select those that we think might have the biggest impact? Have we got that freedom to be able to select? Will we be able to have that choice? Perhaps not. But the very act of thinking of what our priorities are and how we can solve those that present the biggest challenges is of in itself an exercise worth carrying out. And I hope that the whole topic of health financing will become more preeminent in our way of thinking, in the way that we do things in the health sector, in the way that we try to solve problems, bringing in the whole issue. I never knew that a predecessor of mine as chair of Amref termed it medical economics, and that's really humbling, given that he talked about this 40 or 45 years ago. But its relevance is very material, has always been material, but it's ever more material now. And before I start wrapping up, ladies and gentlemen, I want to touch upon something that I always touch upon. Ladies and gentlemen, as I've discussed at various fora, it should be obvious that without increasing the rights and opportunities of girls and women, we as Africa will continue to suffer economically and socially and will not reach our full potential. Gender rights is not a politically correct thing. As I've said in many places, it is an economic, social, and sustainability necessity. It's not something which is a nice to have, or given that we are in the 21st century, we should tack it on and believe that we should clap for ourselves and say that we're happy and be proud of it. It's something that we need to do. Let me emphasize again, it is a necessity without which we will face all sorts of vicissitudes, which if I had more time here today, and I fear that Desta will be here very soon to tell me to stop, if I had more time here today, I would enumerate and expand upon. Suffice to say that the evidence on this matter is clear. It should be noted that this goes beyond choice, that it goes beyond nice to have, and that it goes beyond ticking a box. Gender equality is important. This should start in every household, with fathers and mothers allocating the same attention and resources to female children as they do to males. This has to flow through to university choices, selection, job opportunities, etc. Ladies and gentlemen, I know that many of you here know these things and have not said anything particularly new or profound. That's very good. But as we all know, knowing something and doing something about what we know are two different things. We must do what we know to be right, and given the focus of thought leadership, we need to think further out of the box. This is particularly important for Africa and those of us concerned in balanced growth and sustainable development, which starts, as I said earlier, with health and education. Ladies and gentlemen, until we do this, we will continue to be overly dependent. Some African countries are going to be in that position, and I fear we have to help them. And the only way we can help them if we don't have the resources is to think of new ways of doing things. We need to participate in trying to prevent the challenges rather than trying to solve them when they arrive. We should participate in being part of the solution, not always being seen as part of the problem. We should be part contributors to the global commons of change, and change for the good for humanity, which we are. But we should proselytize this by making to accept them. I will say this, that if you have a very good then the life of the chairman of an organization is, it's like a walk in the park. You turn up and you can come and give a speech like this, wrong. And sometimes it does go wrong. Then you realize that you have got difficulties, and that's when you're really called to do some work. So I would like to thank Gitinji and his team for the excellent work that they have done in organizing this conference, and I want you to give them a round of applause. And once again, ladies and gentlemen, I wish to also thank my excellent co-directors of the board of Amref, starting with the deputy chair of Amref, Mrs. Eunice Matu, and all the other directors that serve on the board, who serve and give of their time as volunteers, and who are part of this Amref family and contribute strongly to the governance and overall efficiency. I'd be grateful if you would give them a round of applause as well. Ladies and gentlemen, I want to thank all of you for being here. I'll start off by saying once again, ladies and gentlemen, that I recognize the excellencies here present, the ministers here present, all our sponsors, all our supporters, all our stakeholders, all the people who've traveled from near and far, the 1,400 of you. And I hope that this conference will be a successful one. I look forward to listening and learning more about health systems and how we might improve the overall health of this continent. I thank you very much for your attention.
Thank you. Thank you, Chair Professor Kehalam. And I hope that high bar he talked about is what he will know to my appraisal. Thank you very much, Chair. Thank you. Now, you've listened to quite a heavy dose of male speakers, and that's just the first dose. Now, the major dose is coming, not of male speakers, but female speakers now, so that we have good representation. And it's now my pleasure to ask my sister, Dr. Matshidiso Moeti, who is the Regional Director Emeritus for WHO Afro. I was talking to Dr. Chikwe earlier, and Dr. Chikwe, who is now the acting regional director, told me he's only doing an internship at WHO Afro. So he called himself an intern. I think if all interns were like this, I think we'd be very privileged. Dr. Moeti, please get in, and after that, we'll move on to the fireside chat. Dr. Moeti.
my brother, Dr. Gitinji. I just want to check that. Of the resource funding continue to occur. The energy, the vision, the determination.
Please stand up for a moment of silence.
I thank you all for your steadfast commitment to Africa's health and for the privilege of having served alongside you. Let's move forward with renewed determination, always remembering that our work is about people, their health, their dignity, and their futures. I thank you very much.
Thank you very much, Dr. Moeti. And I will ask you to stay on the screen because the next session is a fireside chat with you. Ladies and gentlemen, we are coming to the end of this session. I must apologize, it's gone over time, but I think it's been a really critical time for us to reflect on the key things that we need to take forward. I remind you to take the $40 in every session and ask, this is a solution. How do we do it within our $40? How do we repurpose our health system? How do we ensure the health system works? I think because I will not come back on stage, I want to actually do a big appreciation for the team that I work with that has made this conference possible. A big hand to Desta and her team for making this possible. Thank you very much. We really, truly honor you. And to all our Muslim brothers and sisters, Ramadan Kareem. It's now my honor and pleasure to invite my sister here, Rumbi, to go ahead with the next session. It is now your challenge to manage the time. which I failed to do in the first session. Please, Rumbi. Yes.
Thank you. Thank you, Gizinji.
So, welcome, Rumbi.
Thank you very much.
And now you take over from here.
Thank you.
Rumbi, thank you.
All right. Good morning, all. It is my distinct pleasure to have the opportunity to lead our conversation with two trailblazing and straight-talking women, so I don't want to take up too much time. I want to acknowledge Amref, its partners, and all the delegates who've helped us to reach this milestone. I also want to acknowledge all dignitaries and honorable guests who've taken the time to be with us this morning. Without further ado, I want to welcome back the Regional Director Emeritus of WHO Afro, Dr. Moeti. Welcome back. And I would like to welcome another powerhouse, Umeima El Idrissi, all the way from Morocco, the city of Casablanca. She's a municipal councillor, and she'll be joining us for the conversation. Welcome. All right, it's just too much power over here. Dr. Moeti, allow me to go back to your earlier comments on current events and press for a little bit more of your insights there. How do we make sense of these geopolitical shifts? And is there any way African countries and African leadership can leverage this very moment?
Okay, thank you very much, and thanks for having invited me for this fireside chat, even if I'm chatting from my dining room through technology. Indeed, the geopolitical turbulence, including conflicts that have already been referred to, which have tragic consequences. The emergence of migration is a major international concern. We hear about it all the time, and I think it makes part of the, if you like, international political context in which we are working today. So this turbulence is being driven very significantly by growing support for nationalism over multilateralism. This is one of the features that we are observing that is driving some of these tendencies. And this is negatively impacting economic and political stability, is disrupting trade, as well as affecting population movements. Sometimes putting people in very precarious circumstances where they are vulnerable to climate change and its impact on health and on development, the degradation of the environment that we're seeing, and of course ending up in an impact in health. We've already talked about the example of a reduction or suspension of donor funding, the most dramatic example of which has been referred to. So this is resulting in setbacks in key programs such as HIV, malaria, tuberculosis, and we know that health systems that rely on international support are facing gaps in many ways in their workforce capacity, being able to pay salaries, in their medicine supply chains, and in service delivery. In public systems, and if you noted by society and community organizations that often play a very important role in working with the public sector, with governments in ensuring prevention of disease and access to health services concerned. So our countries across the continent are being impacted by this. I will not refer very much to that. I think some of the discussions that happened in the opening, some of the statements, are pointing the way to some of the things that we need to do as Africans in order to navigate these emerging tendencies. One of these, of course, is increasing our own investment as African countries in health and leveraging other resources in addition to the traditional donor resources including looking at the role of some of the foundations that are partners in some of the areas of Sahara. We need to be strengthening intra-African trade and expanding, for example, local pharmaceutical manufacturing and creating, of course, the markets, starting in Africa and internationally for that, and progressively reducing reliance on external donors. Investing in homegrown solutions ensures that Africa is not disproportionately affected by the geopolitical shifts that we are seeing. So I'd like us to encourage and urge all of us to remain committed to supporting African nations in navigating these global challenges, working together as African nations in the way that has been already so eloquently pointed out in the future. And through advocacy, capacity building, and multilateral diplomacy, Africa can ensure its place in a fairer global health and development system.
Thank you, Dr. Moeti. Umaima, I'd love to bring you in here. One of the challenges that we're facing is a demographic shift. And we know that the population of the continent is expected to double by 2050. We're just 25 years away from that, landmark. And I wanted to hear your thoughts. Dr. Moeti talked about homegrown solutions. And those homegrown solutions will have to come from this youthful population, and they will also have to be led and sustained by this youthful population. What do you see as the opportunities for young people's engagement and leadership at this moment?
Well, first of all, thank you, Dr. Moeti, for your intervention. That was very insightful. And for your question, Rumbi, it's a very good question, actually. And then the answer lies in the answer that I'm going to give right now. Young people are already reshaping Africa's economy and governance. They're already doing it. And a real example of that is a young person who has been all over the news recently because he decided to sell sardines, 5 dirhams per kilos in big cities, while the same sardines cost 3 times more, 10 to 20 dirhams, for example, in cities like Marrakesh and Casablanca. And why is that happening? Is because this young person who's reshaping the whole country economy decided to cut out the intermediaries who actually drives up the food prices. And this issue is actually an issue all over Africa, across Africa. So this young person is actually what he's doing is without waiting for government reforms, he found a way to challenge market prices using digital tools, of course, because he got famous while using TikTok. And his story is a perfect example. I just gave you the perfect example of a young person based in Morocco, because I come from Morocco, who literally changed the whole food prices scene because he decided to cut out intermediaries. And this is something that hasn't been done before. And he talked about it using TikTok, using digital tools. And he didn't wait for government reforms. He went out and he did it himself. So his story is a perfect example of how young Africans are not just pointing out the problems, they're actually going out there and finding solutions. And then there is the sustainability angle. The climate crisis is a youth crisis more than anything. Young people are more climate anxious than any other generations. And many solutions that are already in the market right now, especially in Africa, are actually youth-led. I'm thinking about the Tanzanian young woman who turned plastic waste into bricks that are stronger than concrete. I'm also thinking about that African startup who turned shrimp's waste into fertilizers, and that has something that hasn't been done before. And these fertilizers are actually being used right now in many organic farms across Africa. And so African government should be funding these ideas, not slowing them down with bureaucracies. And this is the main takeaway that I want to give today. The real opportunity is for governments to recognize that young people are not just the future, we are already the present, and we are already solving solutions that are right now present in Africa. So that's why we need to support them and empower them and not stand in the way.
Thank you. Thank you. Really strong recommendations that are being made there very subtly. I think there are leaders of governments in the room who are hearing this plea to not hold back young people through bureaucracy, but allow them to soar as they innovate and come up with homegrown solutions. On that note, Umaima, I wanted you to share a little bit more about your thoughts and maybe even reflecting on your own journey about the sense of ownership. There's been in many of the presentations this morning recommendations that we need to become more self-reliant, we need to become more autonomous. What does that look like from a young person's, a young leader's perspective?
Well, the first thing that we need to acknowledge today is self-reliance is not something that we think of or we're dreaming of. It's already something that young people are already working on today in Africa. In fact, my presence here is a proof of that. As a young, proud African and a politician, I've been all over Africa, invited by youth-led organizations that are really committed in and strong believer in self-reliance. And this alone shows that we are not just talking about ownership, but we are actively talking about it and working on it. When I get invited by these youth-led organizations asking me to talk about my journey, how I made it to politics, why I made it to politics, I really try to deliver key messages like I'm doing here today, is like how we need to empower more young people to take ownership of their own journeys and our continued journey. And this alone shows that we are not just talking about ownership again, but we're actually working on it. And we believe in building Africa from within, and we are committed to make that happen. And for me, the true autonomy of African is shifting from dependency to ownership. And for example, economically, we still rely too much on external factors, and Dr. Moeti said that very well. The world is changing every day, and Africa is relying and depending economically on too many external factors that we are not controlling today. And that's why we need to change that. We need to be more autonomous. We need to be self-assertive. I'm thinking today about young entrepreneurs across Africa. Some of them are building caravans, mobile caravans that are traveling to rural areas to provide access to healthcare. I'm thinking as well about those young Africans that are building softwares that provide AI-powered consultations and that can, help people that cannot travel to health facilities and actually give them the ability to see a doctor through a phone or through a computer. So these are proving that self-reliance is not a distant dream, it's a reality we can scale by empowering these solutions. And this taking of ownership is not only economical, it should be political and it should be intellectual. And the more it happens, the more Africa's self-reliance become a reality.
Thank you, Mema. And there is no greater sacrifice, right, than you leaving your career in finance and moving over to take service in public office. So I want to commend you for that and thank you. And highlight that as an example of young people taking ownership of the future of the continent. Dr. Moeti, I wanted to come back to you on the issue of finances, and particularly the financing of sustainable development goals. Again, this question has come up over and over this morning, and maybe it is time we started discussing some strategies. So what can African countries do, and African communities and the African leaders that are gathered here, what can they do to address the concern around the financing of SDGs?
Thanks very much for that very important question. Just before I answer that question on what we do about financing, I'd just like to add a strong example that gives us a lot of hope around Africa taking our future into our own hands, and point to the example of the actions of the African Union during the COVID-19 pandemic, when at the global level there was, despite all efforts by multilateral partners, significant inequity in accessing the tools needed to deal with the COVID-19 pandemic. We saw a really inspiring combination of political leadership at the level of the African Union. President Ramaphosa was the chair of the African Union Commission, and institutions, African institutions, including the Africa CDC under the leadership then of John Garrison, and the Afrexim Bank, and African business people, working together to go looking, prepared to pay, as Africans, prepared to contribute financially for the tools that were available, and then it was up to the international system to provide these opportunities, and that was one of the challenges that came out of it. So for me, that's been a very inspiring experience that shows that when we pull together the political leadership, the technical leadership, the institutions, the institutional capacities, we really do stand a good chance of forging forward, as an African continent, in a more independent, using our own resources more effectively to address our own problems. Now, we're talking about resources again, and concern about financing sustainable development goals globally. Indeed, SDG financing, the financing gap is widening, but African nations can take proactive steps to close it. There's an estimate that Africa needs an additional $1.3 trillion annually to meet SDGs. In addition to increasing allocations, the Howard government must prioritize innovative financing mechanisms to sustain development. I think that the prospects for doing this are there. We already have some examples for some of the SDGs in some of the countries, but because of time challenges, I may not be able to cite some of them. But Malawi, for example, has focused very much around nutrition as a driver of development, as a driver of the quality of the human capital that you have in a country, and is investing in this to ensure that maternal and child nutrition, stunting and undernutrition are being addressed. This is the really key for human capital in the future. Rwanda has a community-based health insurance program, which is very well known. Ghana, of course, is a country that has had community health insurance contribution to the degree that people can contribute, but also recognition that the state has to contribute, and also mobilizing resources internationally to contribute to this basket of financing. Ethiopia also has something that they are doing on water and sanitation, so making the link in financing, integration, financing for health and environmental policies. I think that one of the things that we need to do in Africa is to leverage the resources that we have, the minerals that we have, and create new ways of investment that bring more return to the African countries, as opposed to exporting our raw minerals. And these are some of the, if you like, the economic policies that are being discussed today in many of the countries. We're seeing that domestic financing by governments contributes in some of the countries more and more towards financing health, and there are ways in which some countries that have lower income than others are leveraging what they have in order to contribute financially to health. At the end of the day, we need to mobilize much better the capacity of the public, of the private sector, to contribute to the financing of health in and for find ways to negotiate what happens with international funding. So even if it is being reduced, it needs to be much more efficient in the way that it is being allocated. The fragmented, sometimes disease-specific ways that international funding is provided could be better, could go a longer way if we find ways to integrate around people the way that this financing is being leveraged so that it can help also to develop, as already been said, our systems at the primary care level where we can define the essential packages that are to be delivered to young children, people of certain ages throughout the life course, so that this is done much more efficiently with the capacities that we have in our countries at different levels, and of course the contribution of the private sector. And finally, we need to optimize the efficiency in public funding and invest in the data systems that monitor how public money is being distributed, how it's actually being sent out into the field where it needs to work, and how it is being utilized, and find ways to monitor how that is happening and to create the systems that ensure that the money is doing the work that it is supposed to do efficiently. And then finally, to create as a continent a common market that enables us to get leverage, if you like, the efficiencies of working as a common market. And so some of the institutions that are being established at the level of the African Union, African Essence Agencies, for example, are really going to play a role in this. So it's a combination, as always, of political work, working at the political level, at the national level, at the continental level, investing in partnerships with the private sector, investing in the innovation of those people who are going to have startups that are going to make a difference. And I'm very glad to hear the example that was quoted in Morocco, and making sure that we monitor and we put in place the systems that assure the most accountability, transparency in the way that financing is being leveraged and used in Africa, so that we get the most out of what is being invested by our countries.
Wow, thank you. Thank you, Dr. Moeti, for those wide-ranging recommendations. And I would have loved for us to dig even further and discuss more the practicalities of implementing those solutions. But time is our enemy. I see that we already have to wind down. We were just starting to warm up. The fire was getting hot. But allow me to invite Umeima to make closing remarks, and then we can end with your closing remarks, Dr. Moeti. But Umeima, do you have any thoughts, charges that you want to make to this crowd gathered here today and those who are watching online and those who may watch this video 10 years from now about how we move forward, particularly to advance health equity and to have youth taking leadership in that effort?
Well, first of all, just want to emphasize what has been said this morning by their excellencies and also yesterday during the Youth Summit, is the world is changing, the health sector and the health system is changing, and especially something that has been said by the Excellency, the Minister of Rwanda this morning, which is like diseases are changing as well. Yesterday, governments were investing in lifespan, which is like make people live a healthy way and not die of HIV or malaria or other diseases. Today, these diseases are still existing, but we have new type of diseases, and they are related to wellness. We need people to live better mentally and physically. We need people to eat better. We need people to feel better. And these type of investments need to be made by governments, not only private institutions. So yeah, type of diseases are changing, the world is changing, and government need to accommodate that. I said it again before, and I said it again, young people are actually the real drivers of change. We need to empower them. We need to give them more platforms. And it is in this context that I really want to thank the Amref and all the partners for, first of all, organizing yesterday the Youth Summit, which was a very successful event, giving the platform for young people to engage, to network, to learn from each other and inspire each other. A lot of good things have been said yesterday, and I was really happy to be one of them. And also this morning, giving me, as a young politician, the platform to speak about success stories of many young African entrepreneurs who changed the life of their communities and the life of many people. And I owe it to them today to speak about them and talk about their success stories. So thank you, Amref and partners. Thank you, Rumbi and Dr. Moeti, for being part of this very short fireside chat. I wish we had things to say and sorry, more time to say, and thank you again.
Thank you, Maima. We will have more time over the next few days and in the panel discussions as well. Dr. Moeti, any final remarks? And even as you think about the over 40 years of service, you're looking ahead now as you transition. What can you share with us about the work and the commitment and the leadership we need to invest in driving health equity forward?
Yeah, thank you very much. I think that Africa stands at a very exciting and defining moment today, despite some of the international challenges that were mentioned in the previous section. Africa is leading the G20. Africa has today. So we have a huge opportunity to bring together the thinking, ideas, experiences of African political leaders, African technical leaders, African entrepreneurs, African young people, African innovators, including those that are into using technology, to really define how we reshape our way forward. And what's very exciting is that this is already happening. I think what needs to happen is that we need to position ourselves in the health sector in order to leverage that in ways that are most impactful. For example, we know that the continent is home to the world's fastest growing population and some growing economies. We're seeing, if we look at the geopolitical side, in a few countries, the emergence of governments that are finding ways to, in a way, redefine the relationships with some of the international partners that have led Africa in the past, including, of course, in our past as a continent that was colonized and also even enslaved, whose labor went to develop other regions. I think that harnessing this momentum of change, this growing population, this young population, this innovative population that's connected internationally, that's connected to technology, that will understand how to leverage AI for Africa, even as we retain our other ways of working which make us a communal society, which we cannot use in Africa. Is going to that combination, I think we're in a unique position of the fast development that Africa has had to deal with, that we can combine what's traditional and combine with our knowledge through our young people, our technology, innovation, so that it works for development in Africa, it works for health. We have seen stronger institutions in Africa. That's very exciting. We don't have time to talk about that. Public health institutions in countries that have arisen, partly driven by the impact of the COVID-19 pandemic. And we're embracing innovation in very, very exciting ways. What is needed really is how to improve the partnership between the policymakers, the political leaders, the governments, and these innovative young people, the private sector, in ways that deliver fairness, additional resources, over which we have control in Africa, and then the investment that is data-driven to tackle the worst problems that affect the most people and help us move forward. So So I think that this shared vision, which is emerging strongly, driven by African leadership, is going to unlock a healthier and more resilient future and more prosperous continent. And I look forward to looking for my position over 70 years old as a retirement and talking in whatever role, and I look forward, of course, in being keeping connected to WHO and the role that our organization is going to continue to play to improve Africa's health. Thank you.
Well, thank you, Dr. Moeti. Thank you, Mema. Thank you both for your leadership and for your insights this morning. On that optimistic note, we will end the fireside chat, but we will call it an invitation for more conversation throughout the course of the week. Thank you. You're welcome to step away from the stage, and thank you very much. All right, we're going to transition again in our programming. We are winding down, but you will be excited to hear from the person that I'm about to introduce. So I will be calling on a leader who has been a tireless voice for health equity, universal health coverage, and stronger health systems. He has championed Africa's health priorities, ensuring that the continent's voice is heard on the global stage and accounted for in global agendas. Ladies and gentlemen, please welcome the Chief Intern at WHO Afro, the Acting Regional Director, Dr. Chikwe Ekasi. Oh, you're welcome.
So thank you, Rumbi. Thank you to all our excellent speakers so far. Thank you, Gitinji, for the energy you brought dancing up to the stage in the beginning. You tried to activate the 46 Nigerians in the room. It's the one thing I know we do better than you in Kenya. Honorable Minister, my brother, Sabin Nsanzimana, it's always a pleasure to be in Rwanda. My brother, Raji Tajuddin, you called me Your Excellency. I added it as a prayer point for the future. We're not quite there yet. Excellencies, partners, colleagues, ladies and gentlemen, brothers and sisters, especially our leaders. I see Madam Aisha in the room. My big brother, Michel Sidibe, has just left the room. My sister, Shidi Moeti, just spoke. I really want to recognize that all of us here stand on the shoulders of many others that have laid the path for us. And our responsibility is to take this into the future. So it's really both an honor and a privilege to stand before you as acting regional director for the WHO in Afro. I take on this new role for a very short period with a deep sense of responsibility, but an unwavering commitment, like you know, to the health of the people of Africa. Let me begin by expressing my gratitude for the inspiring conversations that we've had already. It's just a taster to what I know is coming in this conference that is growing to be the leading voice, leading platform for voices out of the continent. The insights and reflections that were shared reaffirm that we all know what we all know to be true. Africa's leadership in health is not just about solving our challenges. It is also about shaping the global health agenda. Today, as we celebrate a decade of Africa-led thought leadership, we must ask ourselves, how do we ensure that greater progress will be made over the next 10 years? What must we do differently? How can we turn these good ideas into tangible action? Over the past decade, we've seen remarkable strides in the health system development across the continent. Life expectancy has improved. Like I said yesterday, in my father's generation, they expected to live for about 30 to 40 years. Today, we expect to live about over 65 years. It is not definitely where we want to get to, but it's a lot better than where we're coming from. We have made great progress in combating infectious diseases, and the post-pandemic period provides even more opportunities to accelerate this. However, as we have heard clearly today, these challenges remain. Too many of our systems and our health systems are still fragile. Millions of Africans still lack access to quality health care. Health inequalities persist, disproportionately affecting women, children, and marginalized communities. And in our context, on the continent, no matter how well we do individually, none of us, nobody in this room, is more than 1 degree of freedom away from these circumstances. So as much as we might evolve and develop our personal circumstances, all our family members, many of them remain vulnerable. So the question is no longer whether we have the knowledge or resources to address these issues. It is whether we have, 1, the will, and 2, the courage to act collectively and decisively. Our commitment to universal health coverage must be unwavering, and it can't be just the rhetoric. We must invest in primary health care, empower our healthcare workers, pay them well, and strengthen the very foundations of our health systems. And these are not trivial. Until 3 years ago, I was working in the public health sector in my country, Nigeria. I know how hard this is. I know how hard it is to raise the resources to pay our public servants a fair wage. But if we don't do this, we cannot develop our primary health care system. So we have to push our governments to invest more to keep the talent that we're building in our systems, to serve our systems. This is how we will build resilience, not just for the crisis of today, but the uncertainties of tomorrow. One of the most stark lessons of the last decade has been the urgency of emergency preparedness. The COVID-19 pandemic, alongside outbreaks of Ebola, Marburg, Mpox, happening today on our continent, has underlined the need for Africa to move from a reactive to a proactive approach. And we have seen the benefits of this. We've heard about the benefits of this morning. Robust surveillance systems are crucial, as are improved laboratory networks and regional manufacturing of vaccines and diagnostics. The ability to detect, coordinate, and respond swiftly to health threats is no longer a luxury. It's an imperative, else we will compromise the progress that we're making in other fields. But preparedness is not only about technical capacity. It's also critically about leadership. It is about ensuring that the decisions made in global health systems reflect the priorities and needs of our continent. This is why Africa's leadership in health security must be relentless. And at this point, let me congratulate the Rwanda Biomedical Center. I've watched this organization grow from strength to strength. The chief executive, my brother Claude, is in the room. This national public health agency is a great example for where we want our future to go to in every African country. So I encourage all the leaders around the room to build their own institutions so that we not only celebrate Marburg, because the Marburg response is, in a way, a very public demonstration of an institution that responds every single day to small outbreaks, small incidents that nobody hears about. And that is the future that we want to build together. We must advocate for equitable access to health medical countermeasures, for fairer financing models, and demand that Africa is no longer seen as a passive recipient of global health interventions, but as a full and equal partner in shaping them. If there's one lesson we should carry forward, it is that the challenges do not recognize borders, but neither do our solutions. So my plea to my brothers and sisters from Rwanda is, please do not hide the innovative solutions that you have built in Rwanda. We refer to them, we are proud of them, but now is the time to release them to the continent and support others in building similar solutions so that we can all develop together and carry the continent along. Health is not the responsibility of governments alone. It requires collective engagement of civil society, private sector innovators, researchers, and communities. Africa-led partnerships must be at the forefront of our agenda, and those partnerships are crucial. Sometimes they're hard to build because human instinct is to seek to be in front, but it's only through partnerships that we can collectively make progress. We must break down the silos that we've built around ourselves and build cross-sectoral coalitions across geographies, and bring together expertise in health, in financing, in technology, and education. The future of health leadership will be defined not only by what governments do, but how we leverage the ingenuity of our entrepreneurs, the commitment of civil society, and the resilience of our communities. These are actually where our strengths lie. So Africa is so much more than a continent of challenges. It is a continent of solutions. We have seen them in other sectors. We have seen other sectors grow. Now it's time to galvanize through the challenges that we face today, the funding challenges. Now is the time to galvanize these innovations that we've seen in many other sectors that haven't had the development support financially into the health sector. Across Africa, we're seeing groundbreaking examples of how homegrown solutions are making a difference. We're seeing new telemedicine platforms, we're seeing new advances in artificial intelligence, we're seeing new community health networks. So we must continue to invest in the research, invest in the technology, to develop the next generation of leaders to take all of this forward. So as we conclude this opening plenary, I urge all of us to look ahead with ambition and determination. Let us raise the bar on the expectations on ourselves. The next decade of Africa-led thought leadership needs to be about action, not only ideas. Let us push for stronger health policies that will prioritize equity and inclusion. Let us build resilient health systems that can withstand future shocks, both epidemic shocks and financial shocks. Let us invest in health security and preparedness. Let us ensure that Africa leads rather than reacts. Let us work together across sectors, across borders, to drive sustainable solutions. I have no doubt that by harnessing our collaborative strength, we will lead, inspire, and transform the global health ecosystem. The future of health in Africa is not something to be dictated to us. It is something in our hands, and it's something that we must define together. That journey starts today. Thank you very much as we embark on this journey together. Thank you.
Do we have the will and the courage to act decisively? Thank you, Dr. Chike, for those remarks. Now, I have been promising closure, and I'm here to deliver. But before we do that, I want to invite two young people to the stage who will help us to close this plenary session. Lister Banda and Maureen Rovina, both from Amref Health, will be leading us in the next session. Thank you.
Good morning, Lester. How are you doing today?
Oh, I'm doing great. How are you doing?
Very good, very excited for AHAIC, and I can't wait to have this whole ceremony and have the whole sessions across the 3 days. How exciting it's going to be, the conversations that we're going to have. What are you excited for?
So excited. It's so exciting, you know. I was just looking at every bit of the conversation that we had. It was so thrilling, so exciting, and so thought-provoking.
It was.
As Dr. Gitinji said, health is at home and not in hospitals.
It isn't.
Because hospitals are only actually garages where repair is done. I mean, who would want to be in a garage?
Go through the whole 3 days. Can we have the Mentimeter and just see what we're thinking about? A litmus test?
Oh, yeah. Actually, it's very many things. However, I think one thing that I can note is transformative leadership, as well as climate change. I mean, it's the talk of every town, I believe, and you agree with me on that.
Yeah, I agree. Mine that stood out is health financing, and now it's the important time for us to talk about domestic resource mobilization. So it's good to see that we are also highlighting health financing within the same.
Exactly.
Yeah.
And even just looking at the theme of this conference itself, connected
for change.
For change.
Yeah.
Addressing the socio-ecological dynamics of health.
Yeah.
And I believe it has actually come at a very appropriate time. You know why?
Yep.
Of course, I think throughout the conversation, they've been talking about the geopolitical turbulence that we are currently actually going through as Africa, which has heavily impacted our health. Let's not be reactive. Let's seek solutions within Africa. So really, when you look at this geopolitical
scenario,
turbulence that we are going through, it's actually a wake-up call for us.
It is.
Let's not just sleep over and just wait upon the Lord to just solve the problem for us.
Yeah.
It will not work.
It will.
It's a wake-up call. It has taught us something, that when we talk about health, it's not only about hospitals and clinics.
Yeah.
It goes beyond that to look at other various aspects. And if we don't address those various aspects, it'll be chaotic.
We'll
it'll be like you're fixing the roof, which is leaking, yet the wall still has a problem. You would not have solved any problem.
And you know what? I think it's high time for us to stop addressing health in silos. It's time, like, we look at the interconnectedness of health. How does climate change affect health? How does food affect health? How does the environment, water and sanitation affect health? Looking at the whole interconnectedness and addressing it holistically, that's the only way we're going to progress as Africa.
Definitely. It couldn't be said any better than what you've just said.
Yeah.
You can imagine, talk about 80% of the maternal deaths, very preventable.
Very preventable.
Does it really count for us to go down that drain for the longest time than we have already gone through?
And can I tell you, half of Africa population still lacks essential healthcare services. So you can imagine, we're still grappling with climate change. We're still grappling with health services. We're still grappling with access and quality of healthcare. So I think it's time that we have these discussions, we have these platforms to come together and provide solutions for the same problems that we have as Africa.
That's very true. Now, you can imagine, apart from the maternal deaths that are preventable, you can imagine 25% of Africa, of the global disease burden, is in Africa. Yet, we only have 3% of the world health workforce. Really? That sends chills down my spine. It really does.
Is it all gloom, though?
No, it's not normal. It's not normal at all. But yet, I believe not all hope is lost.
Not all hope is lost.
Not all hope is lost, because they say opportunity meets the prepared. 100%. And I believe AHAIC is one such conference that can actually provide us with that opportunity to convene. Let's explore what are the potential solutions to the problems that Africa faces. And one day we stand and say, this is the healthy Africa that we had envisioned years back, but now it is here. It's no longer about the future. It's here. I really look forward to that.
And it's good that we have also made tremendous progress within the last decade. Just the last decade, we were at 3%, as you've mentioned, but that 3% is accounting for 5.1 million healthcare workers that we have trained, an increase from 1.6. So that's a tremendous growth.
That's why I said there's hope,
right?
Yes.
And I think we're doing tremendous work, and it's also upon us to acknowledge the work that we're doing. On gender, thank you, Dr. Moeti, for charting the path for women. Thank you, Dr. Kitulu, for charting the path for women. I think these are the conversations that keep us going and keep the path towards universal healthcare.
Definitely. But talk about the 70% that we have in Africa. They are youths.
They are. It's the biggest demographic we have right now.
So what are some of the key highlights then that we can look forward to at this conference?
At this conference. So part of it, we're going to be talking about climate change. That's one of the key discussions that we'll talk about. We'll talk about African leadership. We'll talk about digital innovations. But key to my heart is youth and the youth, because this is the biggest demographic that we have within the continent of Africa. But it doesn't just stop there. I think it's important for us to also say that as the leaders, please provide the platforms for young people to be meaningfully included, not just as a token, but meaningful inclusion, not just pulling a chair for them, pick them up in discussions, make them contribute to policy, make them contribute to decision making, and that's the only way that we can be able to cater for the future. I say the leaders right now are the former youth. Please make way for the current youth.
The same way that it was done to you, please hear us out. And of course, now that you have talked about the youths, that reminds me one thing. I have a friend who always says, we have the two categories, the BBC and the BSc. born before computer and born after computer. So when you look at the born after computer, mostly it's the youth that take strong, keen interest when it comes to technology. So then one of the key highlights at this conference actually will be, we'll look at how can we leverage AI, technology, emerging technology as well as AI and innovations in order to transform the health of Africa, to transform the health system in Africa and make Africa a global leader in health innovation. Are we ready for that?
We are.
May I get a hello? I hope we are ready.
And another topic that we're discussing is climate change. And it's good, Doc, that you said that $40, he said, is spent annually on a person on healthcare. But believe me, we're spending around 9% of our budgets in country climate mitigating, climate adapting, and that is money that can be useful to the health budget. So it's about looking at how this interconnectedness of climate change, of health, of food insecurity, of water and sanitation,
all those areas.
All these things are interconnected, and looking at how we can be able to mitigate and ensure that we are healthy wholesomely.
Exactly. And you know what? I believe that for all this to be achieved, we need a stable mental state of a human being.
We do.
And that is why mental health also is going to be one of the key highlights at this conference.
That is catered for.
Of course, we heard yesterday in the Youth Summit when we look at suicide rates. I think that's a mental health related issue. So that's one of the areas that will also be covered at this conference. Aren't you looking forward to that?
I am really excited and pumped.
I am too.
Looking forward for that too.
I am too.
And now, as we come to the close of the opening ceremony, we want to leave you with a charge.
And actually that charge, I want to categorize it. If you are an investor, what's the charge?
Please invest in African solutions, not just the problems.
And if you are a youth,
if you are a youth, I want you to remember, there's nothing for us without us. We have to be included.
And if it's a leader,
lead with boldness and courage, not with caution.
Exactly.
And so if you're a policymaker, write laws that reflect the dignity of your people. Write laws that reflect the dignity of your people.
Just that. So with that said, really, one thing that we can mention is we are here. We'll be here for the coming 3 days. What is it that we can really drive home? Let's not just make this conference, it's a moment. Well, I attended, it was 3 days, it was in Kigali, it was nice. No, let's make it a movement. A movement that will turn into commitments. Commitments that will turn into lasting impact. When we have actioned all these, definitely we expect a lasting impact for the health that we desire in Africa. Remember, one great man said, healthy citizens are the greatest asset that any country can have. And that's very true. Without a healthy population, do we expect politics to thrive? Do we expect the economy to thrive? Do we expect every other aspect of life to thrive? Definitely no. So it's a call to all of us, delegates, speakers, let's make this a movement. WHO,
let's make this
a movement. Minister of Health, Dr. Sabin, let's make this a movement. And Dr. Gitinji, Amref staff, as well as all other delegates, let's make this a movement. Only when we make it a movement will we be actually motivated to make action, take action, and action that will result into lasting impact for the Africa that we desire.
And with that, the opening session has come to an end. We will now welcome the ballet, Murakoze Chane.
Thank you.
Thank you so much.
Uraho Rwanda rwacu, uraho Rwanda rwiza, uraho rwatubyaye, uraho ngo urw'amata bateze adatema, ngo urw'amata havune imitwe. rutagwabiza ibinaga nkuba zesa mihogo rwamuganye yibaza kumuruza kagira imana abahungu barwaye mama barwaye ahubwo rero iyo muzagaruka mure